In the aftermath of the COVID crisis, we need an independent expert commission to get to the truth about the often deadly mistakes made by government and healthcare officials. Hello, I'm Steve Forbes, and this is What's Ahead, where you get the insights you need to better navigate these turbulent times. The COVID-19 crisis and the too often catastrophic mistakes made in response to it need a thorough examination to learn the right lessons and to begin the process of restoring trust in our public health authorities and institutions. The mistakes were multitudinous, starting with responses by the Centers for Disease Control, the CDC, and the FDA concerning the manufacturing of tests and indeed the nature of the deadly virus and the threat that it posed. Two outstanding healthcare experts, Drs. Martin Kulldorff of Harvard and Jay Bhattacharya of Stanford, have proposed that a group of experts be brought together to scientifically uncover and go over all that was done and not done, and very critically, the reasons behind these policies and procedures. Too often, politics and bureaucratic sloth, not sound medical evidence, influence the decisions made. For example, there was no credible evidence for closing schools. The CDC did it because of pressure from the politically powerful teachers' unions. The damage this did to kids' education was immense. Why in the world were young children required to be masks? Even today, some jurisdictions still want to mask toddlers. The whole issue of masking needs a thoroughgoing probe. In January, the highly credible British-based international research group Cochrane, after a broad review of studies, cast very serious doubt on the efficacies of masks in slowing the spread of respiratory illnesses such as the flu and COVID-19. The creation of the vaccines was a medical miracle, but what was the evidence that younger people had to have them? Some countries like Sweden did not recommend vaccines for kids under 12 except for special circumstances. And of course, there is the whole issue of lockdowns themselves. At best, they only delayed the spread of the virus. They didn't suppress it. Moreover, the economic and psychological costs were enormous. From the get-go, it was clear that older people were by far the most vulnerable, as well as those with serious underlying medical conditions. Yet so much effort was diverted to other parts of the population, an unnecessary focus and a deadly waste of resources. An issue that needs dispassionate study was the suppression of dissenting voices in the medical community about the disease, its nature, its treatment, and its origins. From the start, there were compelling facets about the virus that pointed to its escaping from that Wuhan laboratory. Yet Dr. Anthony Fauci and his cohorts vigorously and even viciously tried to quash any such hypothesis. Why? Honest answers to these and other COVID-19 issues are needed. We must have that independent commission. I'm Steve Forbes. Thanks for listening. Do send in your comments and suggestions, and I look forward to being with you soon again.